I am Dr. Subhash Jangid from Fortis Hospital, Gurugram, and we are expert in doing the joint replacement surgeries with robot and with navigation. So we had our journey of navigation for last 14-15 years, and now we have moved to robotic joint replacement surgery for last 3-4 years. But currently we have acquired the latest robot, which is the Mako robot, which is the latest in the field of robot and the most advanced robot in the world. Now, what are the advantages of this robotic surgery over a conventional or navigated surgery? So first thing is that when we do a knee replacement surgery, we have to balance the joint in such a way that your gaps are equal so that you have a smooth movement of the knee joint from extension to flexion. So there cannot be any kind of play in this joint which will create a problem later on. So this thing we know beforehand. By doing a CT scan, we know beforehand that how much bone or how much cartilage is damaged and how much cartilage we have to remove to put a prosthesis of exactly your size of the bone. So we can, in a different way, we can also say it's a custom tailored knee joint or custom tailored joint replacement. Now you see, if you go to a market and buy a ready-made shirt or ready-made trouser, the fitting is not that good as of that a tailor-made shirt or a trouser. So this knee is actually a tailor-made for you. We can call it a custom tailored joint replacement for you. So with the robot, this is possible to give a custom tailored joint. Same way, when you're doing a partial knee replacement, not the complete knee, only the partial knee is replaced, only this much is replaced. So we need to balance this half of the joint with this half of the joint. And unless we know exactly what is happening on the other side in different ranges, we cannot perform a 100% accurate surgery. So the robotic surgery takes care of those 30 to 40% of unhappy patients who are there because of the conventional joint replacement surgery and 10 to 15% of patients who are unhappy with the navigated knee replacement surgery. The advantage that it is precise, it's absolutely precise by 0.5 millimeter. As far as the angulation is concerned, it's absolutely precise by 0.05 degree. Beside the precision, the size and shape of the implant is matched as to the size and shape of the patient own bone. So you can custom tailor the joint as per the requirement of the patient. Then this fourth thing is that not all patients are having a horizontal joint line. So we can make an oblique joint line as the God has given to you based on your bony anatomy. We can recreate the same kind of anatomy for your joint in a replace process as well. And that is possible only with the robotic joint replacement surgery, be it partial or be it total knee replacement surgery.